Hi, everyone. Welcome to today's webinar, How DENmaar Delivers Hassle-Free Payments for Mental Health. My name is Michael Masasi, Director of Integrated Partnerships at BlueSnap. BlueSnap offers an integrated payment solution that allows healthcare platforms to develop modern, compliant payment solutions for medical providers. With me today is my colleague, Chris Eusted, President of DENmaar mHealth. In addition to being a BlueSnap partner, DENmaar is a full-service mHealth IT solutions company, and they provide medical billing, credentialing, electronic health records, and patient engagement tools for mental health providers. Welcome, Chris. Thank you for joining us.
Appreciate it.
So today we're going to be talking about trends in healthcare technology and some of the areas where health tech and fintech are converging. Chris, you're a true visionary on this topic, so I'm very excited to get your perspective. So to set the stage a little bit before we jump in, coming into 2020, healthcare payments and technology were already changing quite a bit. We'll, of course, get to COVID in a couple minutes, but even last year and for several years before, I'm sure many people can relate to the fact that healthcare spending was growing consistently every year, so much so that it actually became consumers' largest expense, even more than mortgage payments. And the responsibility for healthcare payments in the system is changing and has been changing quite a bit, where there's more and more responsibility falling to the patient. Half of those on employer-sponsored health plans have a high deductible plan, high deductible meaning here at least $1,400 for an individual. So that is what's driving some challenges, and as we'll see, some really innovative solutions around healthcare payments. So Chris, coming into the start of this year, what were some of the challenges that these trends in healthcare were causing for medical providers?
The trends over the last few years have been the collections of revenue from patients due to the fact that you just explained about the increasing patient responsibility, whether it be higher copays or higher deductibles. The trend has been a higher patient responsibility, and collecting that money is always an issue. It has always been an issue. The concept within the industry is to provide as many payment solutions as possible, give them as many options as possible in order to be able to collect as much money as you possibly can. The technology that we are seeing is going to help with that area, the fintech area in particular, allowing patients to use what they are already aware of, things such as Apple Pay, GPay, to make seamless payments, I believe is what they are going to expect, but it's also in the benefit of the organizations to implement that to increase their revenue collections, as well as improve the patient experience. If they can do so, their revenue will be higher. It has been the trend over the last few years. The technology is just advancing in leaps and bounds, and there are truly some great advancements that should solve a lot of this payment issue, lost revenue, essentially.
Yeah, I can't even imagine how convenient and nice it would be if I could use Apple Pay when I'm walking into or out of a doctor's office. That's not even remotely near what I think most people are experiencing.
Absolutely.
There's still a lot of checks in healthcare. There's still a lot of paper billing in healthcare. When patients don't have the opportunity to pay how they want to pay or in a convenient way, I think you alluded to this, it then becomes a collections issue for the provider and puts the whole revenue from the services at risk.
That's correct. And with our particular industry, since it is in behavioral health, it's a little bit different in that you have patients that are returning on a consistent basis. And one of the big acknowledgments within the industry is that once they have completed their sessions or they are no longer coming in for treatment, that revenue very quickly becomes a high percentage of non-collectible money. So putting tools in place to address that while they are still a existing or current patient is very important, and that's where most of our focus has been, and the integration of BlueSnap has been the focus to solve that problem.
So it's an improved experience for the patient, giving them flexibility. It's immediately more revenue for the provider and capturing payment. Is there anything on the topic of accounting and reconciliation that is improved here when you have more electronic methods of payment and you're not working with checks and collections?
Absolutely. Again, going back to the patient experience, patients do not want to be spending a lot of time addressing their payment issues. The statements themselves need to be very clear to spell out what the responsibilities are. Why are they going to make a payment? If not, they will simply not pay the balance due. So integrating within our RCM a clear statement. We're working with an organization called Change, which is on the front end as well in this particular area, so that we can provide clear information to them, but then also the ability to give them payment options to basically simplify their life, as well as the organizations, the administrative staff, reducing the data entry. The system that we have developed in conjunction with BlueSnap allows for a payment to be made automatically, processing the payment through the system on a determined parameter, and those payments can reconcile the balances for the patient, much in the same way that the insurance claim has been, the direction with insurance claims processing has been to automate. Same thing in the patient billing side. The more that you do that, the more that is done in a current environment, the better that the information that is provided to the patient, the better that information is going to be. So they will have complete clarity. You want everything to be in black and white so that they understand, okay, this is why I am going to be making a payment. But the tools to be able to make those payments, reconcile the balances, and be able to provide accurate, timely information is essentially the objective.
And it sounds like it really automates everything from the time the patient submits the payment all the way through recording that in your system, matching it with any insurance payment, and all the way through to money being in the provider's bank account. That's terrific.
Right. That money is collected, deposited into the checking account of the organizations. They have immediate access to that money. And again, the administrative costs are driven down due to the automation factor. It's a great solution for everybody: patient engagement, the administrative staff, revenue collection. It really improves a lot of factors.
That's fantastic. Okay, so let's turn a little bit towards immediately current events. I'm sure what everyone's thinking about as we're talking about healthcare in 2020, pandemic going on. I know that was a huge curveball, especially for you and your company. You did a lot of work launching telehealth and responding to the changing needs of providers this year. Can you talk a little bit about what you've done this year responding to COVID, and how has COVID changed some of those trends that we were talking about that existed prior to this year in terms of focusing on patient payments and patient responsibility?
Yeah, absolutely. The situation with COVID took what was a trend that was occurring over, and was gaining momentum, but was probably still a trend that was going to take a few years to play out, and has crammed it into approximately 6 months. The virtual telehealth sessions requires contactless payment. Again, it's the same exact situation, and what we are doing is allowing credit card processing with predetermined parameters where a patient is not required to be at making payment at time of service in an office. It can all be done automatically. Once the credit card is on file, we're HIPAA compliant with information, and once that information is in the system, all of these things can be done automatically. Being that the provider is not going to see the patient physically, there's simply no way to run with a a point of service type of terminal. So developing the virtual payment system that we have done, it just really was very timely in what has happened with COVID. I believe that once this situation plays itself out, it's still going to be a large portion of services that are going to be telehealth and are going to require contactless payment.
And you mentioned card on file. That's basically the same technology that Uber is using, that Amazon is using, that Netflix is using, what the most innovative companies are using to make their payments really efficient. So your providers that are adopting this type of technology are immediately jumping light years ahead in terms of their payment experience and providing patients with what they're used to in their day-to-day life.
Exactly. I feel the same way, that they are leapfrogging the payment issues by putting this type of technology in place, designing parameters that make sense for them and their organization to be able to process these payments as they feel best for both themselves, for a cash flow situation, as well as in the patient engagement area. Everybody becomes happier from this type of advancement: the patients, the administrative staff, and the owners of the organizations with increased revenue and cash flow.
And with these types of changes, I'm sure there's always some pushback whenever we talk about healthcare, security, protecting patient information, HIPAA compliance. That's always top of mind. Now you're introducing payments. It's another very sensitive area with pretty strict compliance and security requirements. How have you been able to work with providers, get them comfortable with the compliance of your solution, and making sure that both patient information and payment information is protected?
It's always an issue. Anytime you bring up HIPAA, everybody cringes because of the effects if you are not HIPAA compliant. When we initially were working a payment solution, we had started with PayPal. The pushback was very quick on that, even though I felt we had a good payment solution that was advanced. It was not widely adopted due to the fact that PayPal was not HIPAA compliant. And so developing something that became a pretty hot issue for us. Working with you, PayPal is an option for a payment within our system, but it is through a HIPAA compliant terminal, and it eliminates completely the pushback when people are asking. The question is always, is this HIPAA compliant?
And it's a box that you just have to check. Doesn't matter how frictionless Apple Pay is or Google Pay is. If you can't check compliance, they're not gonna get there.
Conversation's not even going to go further if you can't say that you're HIPAA compliant.
Yeah. So I know this has been really the pivotal year for DENmaar in rolling out this solution. The timing, as you said, was I guess pretty remarkable and spot on given everything that transpired. what would you say that you're expecting this launch will mean for DENmaar? Are you expecting you'll have more engagement from your providers, or is it allowing you to reach providers that might have otherwise been harder to onboard to your platform?
Yeah, definitely. The objective is always to provide as many tools as possible. This becomes a very important tool for a couple reasons. Obviously, touching upon the contact list solution, but the other thing is offering an advancement that, from a standpoint of, because we are very involved in insurance claims processing, the standards for that are and have been clearly defined for some time. You have what they call an 835 file, which is basically an electronic EOB coming back from the insurance company that allows our system to reconcile claims. It's taking that type of philosophy and applying it to the patient responsibility. If you can create a system that allows for complete automation from start to finish after a charge is entered into the system, where user data entry is no longer a large part of the equation, you are going to attract traction. And that's what I expect. It also opens the door for us in a marketplace where, again, due to the focus that we have in the mental health area, there are a lot of private pay providers. They do not do insurance billing. So it would allow us to utilize our platform and the variety of tools, whether it be telehealth or clinical tools, electronic prescription, and some of the other things within the RCM that we have. It will allow them to also handle the patient billing. One of the nice features that we coordinated with Change is a mailed statement that can be done just by clicking a button. They don't have to print and stuff an envelope with the statement. The whole system is completely automated, and I think that will open the door for additional practices that in the past we were not really able to service.
That's fantastic. Well, I think that is a good place to leave it. I think you've shared a lot of really interesting perspectives on healthcare and financial technology. It sounds pretty clear that if you can really focus on the patient experience and provider experience while checking the box for compliance, there's no limit to how fast people are going to adopt a more modern payment solution. So, Chris, thank you for your time today. We appreciate you, going over your experience with us. This has been a crazy year, 2020. Your customers are on the front lines of the mental health component of this pandemic. So thank you for helping them help all of us. Thank you for sharing your thoughts with us today. We really appreciate it.
I appreciate it as well. Thank you very much.
And for anyone that wants to learn more about DENmaar or BlueSnap, you can visit our websites, which are on the screen now.